Hello, my name is Dr. Dewan S. Raja. Today I will discuss about mitral valve prolapse. Mitral valve prolapse is a condition in which the leaflets of the mitral valve, leaflet means the cusp of the valve, located between the left atrium and left ventricle of the heart, bulge or prolapse upwards into the left atrium during systole. Mitral valve is also called left atrioventricular valve, also called bicuspid valve. It is sometimes the mitral valve prolapse is sometimes called Clic-Murmur syndrome or Barlow's syndrome. Mitral valve prolapse may lead to mitral valve regurgitation, while blood leaks backward into the atrium. The condition affects nearly 3% of United States population and most commonly in young females. So if you look at the image from the Google website, from the Mayo Clinic, we'll see this is normal heart. This is the mitral valve, the left atrioventricular valve. This is a bicuspid valve. So when the ventricle contracts, blood should go through the aorta. When the ventricle contracts during systole, mitral valve should be closed. And the aortic valve should be open, so blood should go through the ascending aorta, arch of the aorta, and then distribute to the body. But in case of mitral valve prolapse, what happened? Blood is going to the aorta, some or significant amount of blood goes back to the left atrium because the valve cusp or leaflets don't close properly. They have incompetence, so they are not closing during systole. During systole, mitral valve should close, aortic valve should open, but due to mitral valve prolapse, the cusp or the leaflets of the mitral valve will not be closed, rather it will be open. So blood is going through normal passages. Also, some blood is going to the left atria, what is abnormal. Okay, we got that. Now, what are the causes of mitral valve prolapse? Why people have mitral valve prolapse? It is often hereditary and can also be associated with connective tissue disorders such as Marfan syndrome or Ehlers-Danlos syndrome. The exact cause can sometimes be unclear, but it usually involves fibromyxomatous changes in the valve tissue, particularly the leaflets or cusp of the valves. And it occurs here in the mitral valve. The condition affects nearly 3% of US population. MVP is expected to affect around 7.8 million individuals in the United States and more than 176 million people worldwide. So this is a common heart problem. Mitral valve prolapse can be associated with significant mitral regurgitation, bacterial endocarditis, congestive heart failure, even sudden death. Symptoms of mitral valve, symptoms and sign. Most people are asymptomatic. In mitral valve prolapse, on physical examination, the mid-systolic click is followed by late systolic murmur. This finding is commonly heard at the apex of the heart, at the left fifth intercostal space, just medial to the midclavicular line in a healthy person. Heart palpitation is another symptom. Chest pain not caused by coronary artery disease, fatigue, shortness of breath, especially during exercise, dizziness or lightheadedness, anxiety. How to diagnose mitral valve prolapse? How can you diagnose? Mitral valve prolapse is typically diagnosed through a physical exam where a healthcare provider might hear a characteristic click or murmur. That is a systolic murmur. It is confirmed with tests such as echocardiogram, an ultrasound of the heart that shows the structure and function of the mitral valve. Electrocardiogram (ECG) records the electrical activity of the heart. Holter monitor, a portable ECG worn for 24 to 48 hours to capture heart rhythm over time. Treatment of heart valve prolapse. What is the treatment? Most people with mitral valve prolapse do not require specific treatment, especially if they are asymptomatic. However, when symptoms or complications like mitral valve regurgitation occur, treatment options may include medication like beta blocker, like propranolol, or selective beta blocker like atenolol. To manage palpitation, anticoagulant, maybe the, the dicumarol derivative anticoagulant, okay, maybe heparin during pregnancy, okay. So if there is risk of blood clot, valve repair and replacement, in severe cases, surgery may be necessary to repair and replace the damaged valve. It is done by a cardiac surgeon. Lifestyle and management, regular follow-up with a cardiologist, avoiding stimulants such as caffeine. Also, not to lift very heavyweight things. Okay. But maintaining a healthy lifestyle, including regular aerobic exercise like walking, some type of swimming, or maybe jogging with the tolerable level. And that's all about the mitral valve prolapse. If you have any question about mitral valve prolapse, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.